school starting up, currently there are no mask mandates. So just based on the data and the modeling, what kind of, surge in COVID amongst kids do you think we're going to see once school starts up?
So I'll be honest, I'm really worried. And I'm worried for a few reasons. And it's COVID is obviously on everyone's forefront. That's what we're hearing the most about. But if we look at the national data on hospitalizations across the country right now, it's not just COVID for children, it's all the other viral infections as well. So there's one particular virus that is very familiar to pediatricians and many parents, is this respiratory syncytial virus, or RSV. Well, RSV is a key contributor to hospitalizations for children across the country. Well, we're seeing it ramp up, and it's aggressive and it's coming early. So you now have multiple viruses that are all kind of circulating. So as kids go back to school, the masking is important for many reasons. One is, of course, COVID, and it's a new virus, right? So that's why it's getting so much attention. But you also have all these other strains that can also be problematic for children of all age groups. So it's really important to be aware that hospitalizations are up, not just because of COVID, but again, all the viruses. And as we start to get more involved in school and some of the social safeguards start to be unwound, as we recognize people are tired, it's been a long year and a half, but now's not the time to drop our guard.
And what's the status of our hospitals right now when it comes to pediatric care? Is there space for these kids?
So you know what the rest of the nation is telling us, the schools that have already opened up, they saw a massive increase in admissions. So if we look at our, northeastern, southeastern colleagues where they've been in school for a little bit of time, they saw a very quick uptick. So they are running out of space. I think where we are with schools not starting, we're actually in a really, I think, good position because we have the ability of knowing what the other parts of the country are dealing with. So it's not too late if we really focus and we take, heed of what we see going on in the rest of the nation. We can make some plans and we can protect our children, because the most important thing that we've really recognized, and there's a ton of studies that support this, is we need our children to be in school. But we need them to be in school safely. And what does that look like? How do we get them in school and keep them in school and then not have to shut everything down because we have no teachers? Our kids are too sick. They can't focus on, their classwork. So those are the kind of items we need to listen to the nation and, have the benefit of their experience so that we can protect our own families.
You were saying in your presentation that based on the data, you would expect somewhere around, just from Coeur d'Alene School District, 200 hospitalizations of kids, 60 of which would probably need ICU care, and there are exactly 0 PICU beds in Kootenai County. So, could you kind of explain what that, assessment comes from and what it means?
Of course, and that's a brilliant question. So the general trend across the nation, and I want to be very clear, is that there is information, especially with the Alpha variant of COVID, that children did pretty well with it, right? Well, this is a different conversation. This is Delta. So COVID has evolved, right? And this makes sense because that's what the virus is intended to do. It wants to continue to replicate. Well, with Delta, the current numbers are showing that 2% of children who are getting COVID need to be hospitalized. So when you think of that in terms of perspective of numbers, it doesn't sound like a lot, but it is an enormous number all at once to then seek, admission capacity. And when you have the immunization rates that we currently have in Kootenai County, which for 12 to 17 years of age is about 15%, and you start to then factor in the number of students that are in just the, Panhandle Health area, the numbers get pretty significant pretty quickly. So in my discussion, we were talking solely about the Coeur d'Alene School District, which runs about 11,000 children. And if you look at the idea that the elementary age groups, they're not eligible for the vaccine, right? So the vaccine is open for 12 and above. And of that 12 and above that we know are vaccinated, if 15% of those eligible are actually receiving the vaccine. Of that 11,000, you still have 10,000 unvaccinated. And if we go off the American Academy of Pediatrics data that they've shared very freely, 2% of those numbers are going to end up needing hospitalization. So that quickly puts us into a number of 200 students just from Coeur d'Alene School District. That doesn't count Lakeland, Post Falls, charter, the private schools. That's just this one single school district. And the current information is about a third of these kids that are managing to get admitted need an intensive care bed space, and they need that higher level. Gosh forbid, they might even need mechanical ventilation to keep their lungs, expanding and breathing, because these are some rough viruses. With that in mind, you then look around the region and there's just not 60 beds to care for even our school district, much less our surrounding neighbors. So it's a real problem.
Does that mean there could be a scenario where doctors are having to triage children in a sense and decide who gets a ventilator and who doesn't?
You're absolutely right. And that's our worst nightmare. And that's why our team is preparing so rigorously, because we don't have a pediatric intensive care unit, but we recognize when someone's child is struggling and you need to step in, there's a great chance that our team is going to have to then intubate and ventilate a child without a PICU, and then be able to hopefully transfer them to another facility that does. And there are some, but we just talked about there's not enough beds. And not only are we trying to transfer to potentially another hospital that might or might not even have bed capacity, there's a huge labor issue that's going on across the nation, especially in healthcare. So having that bed doesn't mean we even have the staff necessarily at some of these hospitals to even support that care. And then factor in also the idea that, what about transport teams? These are high level transports to bring a patient who's intubated and on medications to another hospital. So you then have to wait on that availability. And remember, these kids they're vying with adults for a lot of these same resources of things that we take for granted, like oxygen and vents. So it's a really scary time. So we really want to try and prevent as much of this as possible, because watching a child struggle to breathe is an awful thing to have to do.
And obviously, the number one prevention method is the vaccine, but there are obviously also a lot of kids who aren't, and a lot of kids who can't get the vaccine yet. So the secondary thing would be masks. So how important do you think it is for the districts to reconsider their current policy and go forward with requiring masks at schools?
I think this is an incredibly important conversation, and I understand where the frustration is coming from. People are tired and they want this to be as normal of an experience as possible. And I think wishing it to be so, it's just not wise right now. There is ample data across the nation, and that has shown that schools that have opened up despite population vaccination rates, if they've really enforced masking, and I'm talking like greater than 92% compliance, they have seen very little transmission. So there is benefit to masking, but it's also paying attention. We have to make sure we're paying attention to our social distancing. What is our classroom spacing? What are we doing in the lunchroom? Lunchrooms can be incredibly a virus heaven, so to say, because that's when the masks come down. That's when you have people in close confines. So what are we doing about those situations? Are we utilizing portable HEPA filters to help, clear that air? What are we doing about our windows or things opened up? And then also, what are we doing about environmental cleaning? So it's a really multifaceted approach. So we really need to vaccinate those that are eligible. And unfortunately, like we just talked about, 2/3 of the pediatric population aren't even eligible yet for this vaccine. We're hopeful for emergency use authorization of the Pfizer vaccine for ages 5 to 11, and hopefully the next couple of months. But a lot of that data is being reviewed before that will be issued. So in the meantime, what do we do about those that do have that eligibility? Well, we want to vaccinate those, because that is the way we will beat this virus. But for those that can't, how do we keep them safe? Number one is going to be masking. Number 2 is going to be social distancing. Number 3 is going to be environmental hygiene and really kind of keeping that clean surface, great hand washing. Obviously, if we're sick, we don't go to school. And then also making sure that we're paying attention to ventilation.
One of the interesting dynamics that I've noticed, and I'm not exactly sure what the laws are in Idaho regarding the power of health officers, but with school districts, you need to have a vote in order to do these sorts of things. And votes are, you're going to end up with a school board that is elected and so more political. With a health board, it's kind of the same thing. But in Washington, at least, a health officer can issue an order under their own emergency authority to have masks. Is that something you think the Panhandle Health District's health officer should be doing in Idaho, is just going forward with their own individual authority and issuing a mask mandate in a scenario where a lot of the more political boards aren't willing to?
And I wish I had an easy answer on that, because I know this is a really tough time, and this is really where we need our leadership to stand up. And I know this is a super polarizing subject, but I think we need to keep our children first. Children are our future, and they have suffered, I think, more than people have realized. They have had health implications. They have had physical, they've lost family members, they've had mental health implications. They're nervous and scared like the rest of us. On top of that, they're falling behind in school. There've been ample studies that have showed that our children are actually falling behind. McKinsey did a survey that showed we're about 5 months behind overall in mathematics and about 4 months behind in reading. There are going to be financial implications that our children are going to have to struggle with for a while. And you start to think about the short term, and then you think about the long term. And I do think we have to ask ourselves, while we don't want to be, the bad guy, and nobody wants to be disliked, there comes a time where leaders really need to stand up and lead and say, this is what's in the best interest of not just our community, but our future. And I don't actually know the logistics of who can pull that trigger. I do know the school board does, they take a vote, and they are aware of what a hot button item this is. And I appreciate them trying to navigate the waters and the information. But I can tell you, just understanding the data and the nationwide trends, we have a really serious problem. And I wonder if a lot of the adults who are really upset about this idea of masking, if they knew that masking was really one of the limited things we can do to protect our children who are vaccine ineligible. And is this the issue that we want to dig our heels in? If even there's a possibility that this could offer help, and there's great data to suggest it does, but even if someone was hesitant, if even the possibility would prevent their child or someone they knew from ending up in a hospital where they didn't have either the staff or the bed capacity to care for that child, is it worth it? And if that possibility is to wear a mask, I really would encourage people to do so, as that is our best bet. And for those people that are in that position to offer, those decision makings and help make these decisions easier for everyone, so that it's not an individual child trying to stand out in a classroom amongst friends and be ostracized for being, the weirdo who's wearing the mask. That's a burden we should never put on a child. I mean, life is too hard, much less having to raise the flag of I'm being different in the middle of a pandemic. It's time for the adults to take that ownership and really realize that we need to protect our children. Just like when they get in a car, we make sure they have their seatbelt on. We go to school, we put our mask on. And you'd be amazed, kids are pretty dynamic, that I really don't think they would fight as much as we think they are doing with the mask. I think it's a lot of just people are tired, and families are tired. And I understand, as I'm tired too, and I can't wait for this pandemic to be over. And these are the things we can do to help it get over sooner.